Hello, I'm Dr. James Bogash, Master of Health and Longevity and creator of Modern Health Myths. And today we're going to talk about to me at least, brand new concept of how we can help amazingly better manage what we are calling, as far as the concern over COVID using up all of our resources. And that discussions, arguments about cases and everything aside, utilization of resources is a big concern, and it's not clear cut. So just because we have hospital beds doesn't mean that those hospital beds are available for an infectious disease like COVID. It doesn't mean that there are soft resources, so like the nursing and the staff that are trained to go with that. So what if we could manage these patients at home instead of having them in the hospital where they could infect other people or other employees? Um, that sounds ludicrous, right? Like, how can we possibly manage these patients at home when COVID is something that is killing people left and right? Um, Interestingly enough, there was one of the larger hospital systems in the southeastern United States, covers some 50 hospitals across 3 states, and they did what was called the virtual hospital system. So they had basically 2 virtual floors. They had what they called the virtual observation unit, and they had the virtual acute care unit. And large group of patients that they studied, almost 1,500, so 1,477, and 88% of these people were able to be done virtually. So looking at almost 1,300 people, initially never had to go to the brick and mortar hospital. They were managed at home. When I first read this, I thought this was crazy, but the outcomes were quite stellar. In the people that were in the virtual observation unit, so not quite severe, they were being managed by home units, kits that were sent to their house for pulse ox, for oxygenation, for blood pressure, for temperature, and they had skilled nursing and doctor's visits. So those people that were at the lower level of acute care, only 3% of them, out of this group of almost 1,300 people that were managed visually or virtually, only 40 of them, so that was 3% of the group, had to go into the brick and mortar hospital. Like, it's a very small percentage, meaning that a huge chunk of these people were managed at home using equipment and close monitoring. Of the people that were in the acute care unit, so basically the at-home virtual but more severe, it was still a pretty small number. Only 13% of them had to go to a brick and mortar location. Like, this is just incredible information, and it completely changes the landscape of how we manage patients with infectious diseases. Now, this isn't pie in the sky. The hospital system actually did this and did it successfully. As always, I will post a link to this particular study in the comment section. You can take some time and read through how they managed it and the numbers, but overall, this was a stellar way to handle this. But before you get terribly excited, the big catch about adopting this throughout the country is always going to be reimbursement. So while we have a phenomenal model that could greatly change the landscape of how we manage patients with infectious diseases, especially through including influenza and COVID, but larger scale implementation is going to have to require the insurance companies to be on board and try to figure out how reimbursement or what it would look like for that scenario. So not sure I'm going to hold my breath on that one, but it would be phenomenal if industry and the insurance companies could get together and manage better solutions for this. So as I already mentioned, I'll post a link to this particular study. Make sure you like this video, share it with somebody who you think needs this information, and subscribe to the channel.